My name is Dyan Moore. I'm currently 50 years old, and I'm very lucky to be alive right now. That's only because someone who wasn't a doctor or this hospital or from the WA Health Department took a lot of steps to prove an underlying medical cause that explained hundreds, if not thousands, of my medical presentations to medical professionals, and the cause of the various separate conditions I was diagnosed with. I found out only 2 years ago that I have a genetic 22q11.2 deletion syndrome. For patients with 22q, the life expectancy is less than 50 years of age. What's worse, after this diagnosis, now knowing that I have this rare genetic condition, no doctor or this hospital or the WA Health Department has sourced a specialist to assist in managing my ongoing care, to source all available latest medical research and updated clinical guidelines for 22q, ensure best practice for testing, ongoing support and coordination across multiple medical disciplines. The impact on my life, or what I call medical neglect, has been so significant. This is hard to summarize, however, I will do my best. I have suffered significant losses in joining in on normal life. I have lost the opportunities of working, having a career, studying, financial security, independence, and having leisure of my choice. I have suffered excruciating pain and extended unnecessary suffering. I have become isolated, been left frightened, confused, rejected, and broken by the health system I should be able to trust. It has broken my family due to the stress it put on my partner and children. I have never been able to get on top of my health, including after my significant diagnosis of 22q11.2 deletion syndrome. I solely blame the health system for this experience. If I was listened to at every medical event and every hospital encounter, I would have been picked up as being sick as what I am, and therefore given appropriate treatments to manage and possibly undo most, if not all, of the above struggles that I had to endure as a person with disability, being told that I wasn't even disabled at all. I've been gaslit for my symptoms. I've had to fight and complain to access healthcare. This has then contributed to complexity to accessing disability support. And when I'm at my sickest, unable to walk or even crawl, confined to my bed, struggling to catch my breath, my heart pounding out of my chest, going in and out of consciousness, or brain going offline with piercing pain, tics, or various seizures, I experienced to drag myself into hospital to seek help, causing further pain, strain, and additional seizures with no accommodations provided ever. My guardian has been ignored, no alternative access choices provided, whilst others do. But I've been told ED isn't suitable for you. This isn't the right clinic. The information on my medical file is inaccurate. I get laughed at for my allergies, told you don't need that test, whereas every time my partner asks for a test that gets done, more things that are expected with 22q are found. Even a very dedicated GP who has taken the time to research this condition and submits the appropriate referrals has these rejected, his calls go unanswered, he can't order the necessary tests or admit me to hospital. He was asked to be part of the care team that never eventuated. So, who will help? So, as you can hear, this is no short story and I cannot make it one. However, It has changed my psyche, so that should tell all. I can only explain it as simply being treated like a refugee who does not deserve or isn't worthy of medical care within my own country. This has been made clear in the treatment I receive that includes abuse, victimization, gaslighting, overshadowing, and neglect every time I encounter any medical system under the WA health system. I believe this is blacklisting within the system due to being female, autistic, having difficulties with communication, and being taken advantage by being tricked to simply make their lives easier, to not look into my health needs, and to always assume it's anxiety and never look for underlying causes. All I have to say is that this has led to my significant diagnosis of 22q11.2 deletion syndrome, which clarifies the organic cause of the symptoms, which is beyond what you were treating me like, which should tell you all how far off and how bad the neglect was. I now have medical PTSD from the repetition of stress I've experienced through engaging with this hospital. I was told I was perfectly healthy to the next minute at 48 that my life expectancy of 22q was most likely 50s. I am broke, disabled, and lack a relationship with my family due to the trauma of my medical experience, and with possibly only a few years remaining that I can guarantee to live. When I ask for what is, if everyone here today is to understand that whatever decision anyone makes, no matter how small or at any phase of any of this, these procedures can cost me. My life could be cut short significantly, including my quality of life being extremely poor. That is my biggest concern. Thank you for listening to me here today, as this is something you'll never know how much it means when you have spent decades not being listened to within a medical setting, even including this. Thank you. I am Dyan. I have a genetic chromosomal disorder called 22q11.2 deletion syndrome, meaning I'm missing 30 to 50 genes, possibly affecting nearly 180 different body components and symptoms, and I will die if you don't help me. Thank you.